Hi, my name is Rachel Gray, and this is my persuasive speech about women's healthcare and why we need to start thinking about a reorganization and new ways to think about the healthcare of women. Imagine you are a young woman. All you know about your body is what you've learned from the basic videos that the public school system is required to show you. That's all fine and dandy until you realize that those videos depicted things that were not your reality. Often women believe that their reproductive issues are something wrong with them and that this is something that only they are experiencing. Unfortunately, the fact of the matter is that a lot of the issues we see in women today are not normal, and they could lead to significant fertility issues as well as severely damaging long-term diseases. Women need to be made aware that these things are not normal and that we deserve to have the ability to speak out and be made aware of the possibilities. Unfortunately, due to many issues regarding age, women's health care and health issues can go undetermined into young adulthood and later in life. There's also issues about whether or not women should be believed about the experiences that they're having within their bodies. Without taking agency for our own health, we may never see a world where these issues can be avoided or overcome. With a healthcare reform, however, we would be able to possibly enjoy being a woman and know what that means. The current policies are heavily focused on age, which can cause many significant issues to go untreated or undetected for significant amounts of time. According to Planned Parenthood, pap smear exams are only recommended to people after they turn 21. After that, they're only recommended every 3 years, as long as there's no abnormalities. Planned Parenthood also shares that the reason for doing the pap smear is that in the search for these abnormalities, it's frequent that you don't see them until the age of 21. However, because these tests are not being recommended until the age of 21, whether or not they are showing up in women, it goes untreated. These issues can cause significant health concerns later in life, such as cancers. And it's reported that these cells can often be problematic, and not only could they give you some sort of long-term disease, but they can affect your fertility. It's incredible to me that because it is not typically seen that these issues arise until that age, we aren't still looking for them. Not only that, but doctors are not believing women about what they're experiencing in their bodies. Unfortunately, women are not believed about the pain that they might experience during menstruation. Lindsay Bever from the Washington Post says that women often cite pain bias around areas of reproductive health. Endometriosis, labor pain, insertion of an IUD, all of these things can be extremely painful. Hopefully, I don't have to tell you that. And women are often seen as hysterical when they're in pain, rather than searching for why this pain is occurring. It's believed that this pain is psychological and not physical. And due to this issue, once again, women's healthcare is often being overlooked. For women, pain during menstruation can be normal, but can also be a sign that something is wrong with your body. Something is not working as it should. For me in my life, pain was a sign of a genetic condition. This condition went untreated for me for about 11 years due to the lack of belief about the pain, as well as the ages I had to be in order to be tested for certain issues. Due to this, I have significant fertility issues, and I will probably not be able to even try to have a child after the age of 28. If these issues had been caught earlier, they could have been treated a lot earlier, and I might have had more time. As women, we have a right to be outraged that our pain is not being taken seriously. It is not fair to us that we have to suffer rather than being treated for the issues that exist within our own bodies. Unfortunately, the current political climate is moving away from women's health care. And until political reform can occur in favor of a truly comprehensive women's healthcare system, the best way that we can seek care as women is to talk about the issues that we are seeing in our bodies and educate ourselves on how to best take care of our bodies. The National Organization for Women tells us that the best route of action when working towards women's healthcare is that we must continue to educate ourselves all day, every day. As much as we can, we should be educating ourselves. We must continue to educate ourselves outside of medical facilities, and we need to know about the possible issues that can occur and how they can be treated. Rather than allowing medical professionals and the government to prescribe and make choices for our bodies, it should be us. With laws like the Roe v. Wade being overturned, we are being silenced about the rights that we as women have to our bodies. It's our job to speak up about the issues we face on a daily basis. Change cannot occur if the issue is not being discussed, because nobody is going to know that there is an issue. Unless we address it regularly, this will continue to go unnoticed. It's imperative that we work together as a team to continue to educate one another about the facts surrounding women's healthcare, the signs to look for when considering abnormalities or problematic conditions, and the full range of options that we have in order to find harmony within our bodies. If we as women cannot work together to spread awareness and to push lawmakers for changes based on the education that we are spreading and that we are communicating to one another, we are never going to see a single change in this system. Women's healthcare is something that most women agree should be a basic right for life. We deserve to not be in pain. We deserve to be listened to and we feel something that might not be normal. We deserve to understand all of the possibilities for treatment and choose what method we are going to seek out. We deserve to know whether something happening in our bodies is or is not normal. We deserve early detection for our diseases or our conditions. We deserve to be treated like medical patients with solvable issues. It's up to us as a society to determine how hard we are willing to fight to see this comprehensive healthcare and to better the lives of the women around us. So my question for you is, how can you help a woman feel healthy today? Thank you so much and have a great day.